and I feel bad because I keep coughing and you probably hear me in the background and everything. But man, there's a cold and crud and all kinds of stuff going around now, but it's RSV that still is making headlines here in Northeast Ohio and around the country. Local children's hospitals are admitting a lot of kids for RSV infections, and that surge typically doesn't happen until the end of December.
Yeah, and all of this is today's top talker. It's something a lot of parents are very worried about. We talked about this yesterday. We want to explain it a little bit more to you, and you know the drill. We bring in our senior health correspondent, Monica Robbins, for all things medical based. Monica, good afternoon. Parents need to pay attention to this.
Yeah, they really do. And normally, I mean, it's not an uncommon virus, but it is a little uncommon to see it as we're seeing it now, because we expect to see respiratory syncytial virus, or RSV, start to pop up in the colder months, but COVID seemed to have switched things around. We saw a bunch of cases in May. Now we're seeing it in early fall, and we're seeing it a lot. Most kids who get sick with RSV will be able to recover at home with supportive care, like a vaporizer for the congestion and child pain relievers. However, if your child's symptoms are not improving or getting worse, do not hesitate to call your doctor. RSV is very contagious. It spreads through the air and high-touch surfaces, and something else to think about, especially if your child is attending some Halloween events with a lot of other kids.
If there are large indoor gatherings that aren't necessary, or a child could potentially be around somebody with cough and cold symptoms, it might be best to rethink those plans and keep the younger children home.
So it is a more serious illness for infants, preemies, babies with heart disease. Those with lung diseases are especially at risk. So pay attention to infant behavior, such as irritability, poor feeding, tiredness, not having as many wet diapers. It's highly contagious, so it easily spreads through those child care centers and schools. And symptoms include the runny or stuffy nose, cough, sore throat, fever, mild headache. And in younger children, it's not uncommon to see a decrease in appetite a few days before the cough starts, followed by sneezing, fever, and in some cases wheezing. RSV testing is available. It can confirm if your child is fighting that particular virus, and you would expect pediatricians will also test for flu and COVID to rule out those viruses. So that's something you need to think about and have a very serious discussion. There is no vaccine for RSV, but there is a vaccine for flu and COVID. So that's something you might want to talk to your pediatrician about.
Oh, it's so heartbreaking to see the babies in the hospital. I mean, anytime kids are sick is awful, most certainly. How bad is all of this here?
Pretty bad.
Really?
Yeah, it really is. I mean, and seemingly getting worse. All of our hospitals are admitting kids. Rainbow says it's admitting nearly 5 a day. Akron Children's told me it's already admitted about 80, which is typically what they see by the end of December. All of our children's hospitals are also starting to see flu, but it's mainly RSV that is bringing the kids in. So it is seriously something, and it's like epidemic. If one kid gets it in school, then it just spreads throughout the school. And most parents are going to think it's a cold because it seems like a cold, but for the little ones or those, if that fever just won't go away, obviously any parent knows that.
And it's just coincidental that it happens after COVID. I mean, this is just it's time.
Yeah, and like I said, we were still dealing with COVID in May when we saw it, but that was a weird time
to
see it.
Yeah, very weird. Okay. Monica, thanks. I'm sure you'll keep an eye on it.